One of the parts of the first aid kit that we've got is aimed at stopping pinpoint bleeding. And a lot of people who are trying to trim their own pet's nails, or their pet has scrabbled, clambered around, we do see nail trauma, for example, quite commonly. And if this is damaged back to the quick of that nail, they can bleed quite a lot actually and spread quite a lot of blood around, which can be concerning. And if the wound is perhaps more extensive, you can actually get a nail bed infection that can go into the bone of the end of the toe. So we want to manage that at home before it's presented to the vets to try and reduce the risk of that. First up, we may want to wash the wound. So we're going to use iodine just as an example here today. I've got 30 mils of water here, which I'm going to be using for my flush. And I'm going to add 2 mils of iodine to that water. And what we now have is an iodine solution ready for flushing. What I have after that is some basically saline from our eye wash pods to rinse the iodine out of the wound. We've got gauze swabs to clean that wound area. And then having done that, we may want to put some dressing material over the injury. And we have a pair of scissors to help us with that. For demonstration, we've got a bearded dragon. Coming out. And basically for this, we're just going to have a look at their feet. And she's got really nice nails actually. They're pretty much bang on the length that we want. But if this was traumatized or damaged, you may see bleeding coming from here. And what we want to do is to avoid getting any infection creeping back up the nail. So for these, if you've got a bleeding point, we have our gauze swabs, which again you can use also for your wound flushing and cleaning. But the first thing to do is to try and stop the bleeding point from bleeding. So applying pressure with that swab can help that, and you just have to sit and wait for a few minutes for that to be the case. Beauty of bearded dragons, because they are amazing creatures, is they will sit here and you're being very good at your acting, aren't you? You may want to flush wounds if you think there's debris in them. Again, we're just using iodine as an example here, but this can be flushed across to clear any material out of that. Again, rinse them afterwards. If it's a tiny point, then our little Q-tips are great for this actually, because you can actually just pop them straight onto the point of bleeding and you've got pressure right on the area that you want. And because they are got the sort of wooden with a stick behind them, you can actually put a bit more directional pressure on a point. It doesn't have to be a toe. You've got another bleeding point. You can again just use these to put local pressure onto that site to stop bleeding. Minimal restraint needed really for a lot of species for doing this, but that just is getting pressure onto that site. If applying pressure is not controlling the bleeding, we have our caustic pencils. The silver nitrate pencils that we have with our kit have a safety advice sheet. They are caustic, so you don't want to be touching them yourself, so again wear gloves for these. They are really to be used just for stopping pinpoint areas of bleeding like you'd have with a nail, maybe with the end of a beak for example, or if there's a specific small wound that you need to cauterize using the caustic pencil. You would apply this directly on the bleeding point at the tip and just keep pressure until it stops bleeding. And if it was somewhere else on the animal, there was a bleeding focus for example, then again you can just apply this directly to stop that bleeding point from there. And of course you've still got your cotton bud that you can apply again to put pressure onto a bleeding point to stop hemorrhage. And it may be this is something you might try and bandage afterwards. It might be suitable for that, maybe if it's on the body or higher on the leg. But for the end of a digit, then realistically you're not going to get a dressing on there that's going to stay, and we need the caustic pencil to stop the bleeding. So we have our bearded dragon, and we have basically a piece of tape as a fake wound for illustrative purposes today. We want a nice surface that they're comfortable to sit on, not going to get distressed. We've chosen a towel here, then we obviously can flush this wound and the extra fluid can go onto the towel, we'll need a second person to help. Just basically comfort the animal, restrain the biddy while we're doing this. We've got our iodine ready for flushing and rinsing afterwards, and rinsing is important after flushing. And then we've got just some light dressings that we can apply over this wound after flushing. I would probably cut your dressings to length. It just makes life easier because then you're getting everything ready, and then roll them ready so you can apply them quite easily. It's all about getting everything ready before you do something to minimize the length of time that you spend doing it. So in this circumstance, we would get the wound in a position that we're happy to flush, and we're just going to flush, like I say, down onto. You want to watch us? And basically the aim is we're going to flush that down to clear debris out of that wound. You can do as much flushing as you need. More flushing, the better. It's important once you've flushed the wound with a disinfectant that we need to rinse the disinfectant out, as the disinfectant can impair wound healing or cause inflammation if left in place. So always use some sterile saline from the eyewash pods to rinse the disinfectant out. Then we're just going to apply a light bandage. Don't want this to be too tight, it's just to cover the wound to stop more debris or material going back into the wound after you've cleaned it. And we're gently just going to cover the wound here, just to make sure no more debris, poo, substrate can get into it. And we're just going to put a second layer with a conforming bandage over this, just so it doesn't slip. Not too tight. All we're doing is covering a wound before she comes to the vets. So just a very light dressing. Leg can still move quite freely, but we've now covered and protected the wound.